2 weeks later, after having this conversation, a 62-year-old man comes into Dr. Adai's office for the first time. He had just gotten his diagnosis of having prostate cancer. And Dr. Adai, instead of giving him advice, instead of telling him what he ought to do, he asks the question. He asks the question, what does this cancer diagnosis mean to you? And the man starts talking, and he starts talking about how his father had died when he was 17 years old. And this had just been so hard for him, and it had been so hard for his mom. And then he starts talking about his grandchildren and his fears for the world they're inheriting, what with climate change and everything else that's going on. Dr. Adai had expected this guy to at least bring up cancer, to at least mention mortality or pain, but it never came up. And at that moment, Dr. Adai realized, because he had asked this deep question, that this man wanted to have an emotional conversation. He wanted to talk about, how do we feel? He needed to be hugged. And so Dr. Adai didn't actually hug him, right? But he did the verbal equivalent. And then Dr. Adai says, look, do you mind? There's some medical options I'd like to talk over with you. Is that okay? And they move into a practical conversation together, and within 7 more minutes, the man decides to do active surveillance and never looks back. Dr. Adai's patients overwhelmingly now opt for active surveillance, his advice, because of this approach. And the thing is, we can do this in any conversation.